What has been your experience addressing endometriosis clinically as a functional medicine provider?
With being in this aspect, right, in this specialty, many of our patients are just trying to find answers that they're not getting answers to. Like you said in the statistics, they don't normally find this answer until they've been in 7 visits, right? That means 7 different doctor visits have failed to figure out what's going on with their pain, their fatigue, all of the symptoms that are associated with endometriosis, which could be many things, right? And so we're lucky because we get to actually investigate the root cause. And then when you actually dive into it and investigate all of the different root causes, we would lead to the diagnosis of endometriosis after we looked at everything that was going on, right? Or they would come in with a diagnosis of endometriosis already and say they're not getting taken care of. And it's because they're not looking at all of the underlying factors. They may just be looking at their hormonal component, right? But they're not looking at all of these other aspects. And as a functional health practitioner, we actually have to address all root causes. And a lot of times it's multiple. There's
Yes.
multiple things going on.
Yes,
What is your
yes.
experience with that?
Yes, same. And most often when women are coming into my practice, they are coming with the diagnosis,
Mm-hmm.
but it's been a long journey. Definitely want to do a lot of listening and, making sure that they feel heard and seen and validated. But just like you said, what I appreciate about working with patients with endometriosis is that it doesn't take a lot of major changes to cause good positive shifts when it comes to
Mm-hmm.
their symptoms. Cleaning up their personal care products and making sure they're
Mm-hmm.
not getting a ton of endocrine disruptors, which is one of the root causes that we'll talk about today. Those sorts of things, changing their period products and, actually looking at their hormones and trying to balance them can really take them a long way into
Absolutely.
kind of getting through all of that. Yeah.
Absolutely. We
Yeah.
want to go into other factors that practitioners often miss, right? And one of them is going to be this main root cause,
Yeah.
which Dr. Sarah touched upon, which is endocrine disruptors. This is a primary functional medicine root cause of endometriosis. It's the exposure and the prolonged exposure to EDCs or endocrine disruptors. These can be synthetic in nature or natural substances. What EDCs are is they interfere with hormonal function, and it's often by mimicking estrogen. Most often, this is a estrogen dominant type of condition, or it's blocking other hormone receptors as well. So let's take a look at an image and we'll kind of explain this a little bit further on how this works. And this was from a 2024 review article in the Journal of Immunological Tolerance and Regulation. What researchers found, they investigated the negative impacts associated with dioxin. It's called TCDD. This is a highly persistent and it bioaccumulates, and it's a major pollutant, and it's formed by a byproduct from industrial activities. And because it's extremely stable as a chemical and it likes to hold on to fat tissue, it's going to accumulate in the food chain, especially in some of our dietary fats, and it can remain in human tissues for years. And that's what this image is all showing, right? When it holds on to the tissue, right, it can lead to inflammation of the endometrium, and it can block certain hormones such as progesterone that we're seeing there. It can lead to an increase of gonadotropin releasing hormone along with LH and FSH, which actually causes a negative feedback to our progesterone levels. It can also impact our liver with that bioaccumulation and cause an excess circulation of estrogen as well. And so what this study provides is it provides a really comprehensive review of how this exposure to this contaminant TCDD, and it's a potent dioxin and EDC or endocrine disruptor. It's going to adversely affect reproductive health through immune, hormonal, and epigenetic mechanisms. How does this happen, right? So let's just kind of dive into this a little bit further here. We talked about some of the estrogenic effects. So what EDCs do, like BPA, this is found in plastics, we've heard of that, and or phthalates, these are also found in personal care products. They have a high estrogen-like activity, and this can bind to estrogen receptors. It's going to activate certain pathways that's going to increase the growth and survival of endometrial-like tissue outside of the uterus. And then there is a hormone receptor activation. It's going to bind the estrogen receptors, ER alpha and ER beta, which we're seeing in that picture there. And these chemicals can upregulate estrogen responsive genes. This can lead to the proliferation and maintenance of ectopic endometrial tissue. There's also disrupted detoxification, which I mentioned earlier. It's going to overload some of our detox pathways. What are those, right? Those detox pathways are our gut, our skin, our liver. In particular, these EDCs are going to impact our liver detox pathways. And if you cannot metabolize estrogen properly, what happens? It's going to continuously circulate within the body, and it's going to cause those estrogen dominant type of symptoms. This can lead to endometriosis progression. And it's that persistent exposure to these EDCs, and it's that prolonged persistent exposure that can accumulate in body fat and then can maintain our chronic exposure as well. So how can we prevent this exposure? What you can do is look at your common household items, and these are going to be common sources of EDCs. The first thing is going to be plastic. These are going to be your food containers, your water bottles. So you want to take a look at your environment and your household, and how often are you using plastic? If you're using plastic often and you're at risk for endometriosis, or your patients are at risk, you want to have them start to switch from those plastic containers to glass containers, right? Then you want to have them look at personal care products, such as their lotions and shampoos. Are they containing phthalates? All they need to do is send you a image of the ingredients in the back. If it says phthalates in there, you want to have them remove those personal care products from them. Other things are going to be pesticides. You can easily refer to the EWG, it's ewg.org, and have them look at the Dirty Dozen list or the Clean 15. And this can help to reduce their pesticide exposure, such as the DDTs or the PCBs, because these are contaminated in our food. So having them remove those will be beneficial as well. And then household cleaners. Again, this is going to be some things like your detergents, their detergents, having them look at those detergents. And if there are nonylphenols in them, having them discontinue that detergent and going into an alternative that doesn't have some of these EDCs. And this is going to help prevent and the accumulation of these EDCs, which is going to decrease the risk of endometriosis or help to improve their endometriosis over time, because it's going to take that total tox burden away from their liver. It's going to help to metabolize their estrogens, and it's going to help all of their metabolic processes function better as well as improving their hormones, which are all the impacts of endometriosis.
Exactly. And think about all of the things you listed. I mean, everyday items, especially as women. I mean, we use our moisturizers every day, sometimes
Mhm.
twice a day, makeup, lipstick. Not only is it on our lips, but we're eating. And so we're kind of eating and drinking what's on our lips. So,
And I
yeah.
mean, these household products, they're the lotions, like you said, they're
Yes.
on your skin, they're being absorbed. constantly, every
Yes.
day, all day.
Exactly, yes. Even, I'm so glad you talked about, like, laundry because, when I bring my patients in and we talk about, lifestyle changes, and we talk about these things, I mention dryer sheets, and
Mhm.
they're like, "Oh my gosh, I have to get rid of my dryer sheets," and it's like, "Yeah, because your clothes are sitting directly on your skin, and you're absorbing that, you're wearing it all day, especially if it's workout clothes and you're sweating in those and absorbing the toxins you just released from your sweat and the
Right.
ones that are on your clothes. So,
Exactly.
um,
This is just an opportunity as a functional medicine practitioner to really educate our patients, right?
yes,
That's such a big part of our practice is to educate them on these things. And most often our patients aren't aware of this.
yes, exactly, exactly. Our most powerful role as a functional health practitioner is being a teacher,
Mhm.
and just teaching people so that they can make better decisions and better informed decisions.
Absolutely.